For nation shall rise against nation, and kingdom against kingdom, and there shall be famines and pestilences and earthquakes in divers places. All these are the beginning of sorrows.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
The number of people infected with coronavirus surged by more than 3,000 overnight as experts worry it could become a pandemic. This morning in the epicenter city of Wuhan, a newly built hospital dedicated to treating the virus started to accept new patients. More than 420 people have died in China and more than 20,000 people have become sick worldwide.
In many parts of China, this is the new normal. Very few people on the streets, and the usually crowded public transport system all but empty, like here in Shanghai. Every passenger is stopped, and every passenger screened for signs of the coronavirus.
I would ask you about the raft of measures that we've seen countries take to try to contain this outbreak. Multiple countries evacuating their citizens from affected areas. We've seen China shutting down or locking down entire cities. Is this the right approach to stop this from spreading?
It's the right approach at the current time. Time will tell whether or not it's been effective in either stopping or slowing the progress of the virus. I think as the numbers continue to rise, it looks increasingly likely that this will become a pandemic and will eventually spread around the world.
We've seen, as you said, this is spreading, and we've seen first cases reported in the Philippines, in India. These are densely populated countries. Ian, how worrying is that to you if we look at efforts now to try to contain the spread?
Yes, it is worrying for two distinct reasons. One is, as you say, these are very dense populations, so the opportunity for transmission among people is much higher than it would be in a low population density country. But in addition to that, these are areas of the world which also have quite a high burden of respiratory disease, particularly things like TB. And until the virus gets there, we really don't know what to expect in terms of the severity of the infection in those target populations.
I think the concern is that the diseases that we see emerge have I would almost say, a Darwinian imperative to find, communities where they can break out and propagate. And Ebola is a great example. Ebola was discovered more than 40 years ago and ultimately found in West Africa sort of a perfect setting in which you could have a large explosive outbreak. And now we're in the midst of the second largest outbreak of Ebola ever. So the two largest Ebola outbreaks ever have both occurred in the last 5 years, and I don't think that's a coincidence. Now we're seeing the emergence of a third coronavirus. SARS was the first coronavirus that we had significant concerns about. It broke out in 2003. MERS came along a decade later. Neither of those viruses was very easily transmissible. They were transmissible. They caused a lot of disease. But we knew that coronaviruses as a class represented a threat to humanity. And what people are concerned about now with the current coronavirus is perhaps this is the coronavirus that we've been fearing, which is one that is more easily transmissible than SARS or MERS, and with a lethality that is sufficiently high that if it became a globally disseminated disease could potentially affect a very large number of people and potentially cause tens, hundreds of thousands of deaths or even millions of deaths. And that's a really frightening prospect.